What are the causes of hydrocephalus, right? As we have discussed, that hydrocephalus mean excessive CSF in the cranial cavity. Now, what could be the reason of excessive CSF in cranial cavity? Let's go very logically. Why there should be excessive CSF in cranial cavity? Problem number one, either there is a problem with the production, you produce excessive CSF. Number two, or there is a problem with circulatory system, or there is a problem with drainage. So there are three levels that CSF, right? Hydrocephalus may be due to, yes, increased production or abnormal circulation of CSF, or it may be reduced, yes please, drainage of CSF. Let's deal one by one with these situations. Normally, CSF is produced in a very, very stable fashion. Listen carefully. CSF production is very, very stable. It's about half ml per minute, or it is about 500 to 550 ml per day. About half liter CSF daily you produce, right? And production all over your life is very, very stable. Major causes of changes in CSF pressure are not due to production problem. Problems are with the drainage or circulation. But rarely you may come across a patient who has a problem with the production. You know CSF is produced by which special apparatus? Choroid plexus. So, and you know that there are choroid plexus present over here. Is that right? Of course, choroid plexus also here, and choroid plexus also here. Is that right? These are production point. If someone develop a tumor of choroid plexus, it's rare, but it may be a cause. Someone develop a tumor of choroid plexus which is over-functional. So he may be producing too much CSF, but this is a very rare cause. It is only when you want to impress someone academically. So we can say number one cause is, yes, we put the number one cause here. Excessive production of CSF, a rare cause. But if you really want to tell a cause, one cause may be just a tumor of, hyper-functioning tumor of choroid plexus. Is that right? Now, so there is only one cause I told you here, that is increased production, and increased production means tumors of choroid plexus. Now, abnormal circulation. When we talk about abnormal circulation, right, abnormal circulation may be at this point. What is this point? Foramen Monro. Due to some reason, through the foramen Monro, if CSF from the lateral ventricle cannot go to the third ventricle, there is some blockage at the foramen Monro. So this may be point number, yes, 2. The foramen Monro is blocked. What could be the cause of blocked foramen Monro? Sometimes there is a cyst formed into third ventricle. We call it colloid cyst of the third ventricle. That a small tumor like ball is made here. For example, this is your third ventricle ependyma. From here a ball is made like this. This is a disease, of course. And if this ball gets stuck into foramen Monro, then CSF from this ventricle will not drain. Is that right? Again, let me show you more clearly. This is your third ventricle, and this is cerebral aqueduct. Here is, let's suppose, your lateral ventricle. And if a cyst form here, and this cyst make a block here, I mean very naughty cyst, because sometimes it blocks, sometimes it dislodges, sometimes again it blocks, sometimes it dislodges. We call it intermittent hydrocephalus. What really happens here, that because choroid plexus is producing the CSF, but it cannot drain from this to down. So what will happen? This will become enlarged. And when lateral ventricle, for example, this is left lateral ventricle, when this lateral ventricle become enlarged, right, the high pressure and enlargement and expansion of the lateral ventricle where foramen Monro is blocked, the high pressure will compress the brain substance and lead to damage to the brain substance, right? And if brain substance is damaged, is that right? That may lead to eventually, for example, if it's this ventricular cavity which has enlarged in a very big area, ballooned up, the brain substance is damaged, and you may find that remaining cerebral cortex is just like a small shell which is applied against the skull, right? Let me show you exactly how it will look. First, look at healthy situation, right? This is suppose healthy situation, but here is normal lateral ventricle. Here, if lateral ventricle enlarge too much, right? Do you think skull can expand? No. So if really it enlarges, it compresses which brain substance, and you will find that in healthy area brain substance is in good amount, but here brain substance will be in a, you understand what has gone wrong? Shelled out. So if on MRI or CT scan you just find one ventricle is very much enlarged, maybe foramen Monro is blocked. Is that right? The next point is blockage. Point number 3. What is this? Cerebral aqueduct. We are talking about the mechanisms of hydrocephalus. One mechanism, the first mechanism was excessive production of CSF. After that, we are coming across the problems with abnormal circulation of CSF. Now, number 1 is foramen Monro is blocked. Number 2 is everything is okay, but there is blockage of cerebral aqueduct. When there is a blockage of cerebral aqueduct, what will happen? First of all, what could be the cause of closure of cerebral aqueduct? One is congenital. Some babies are born with stenotic or narrow cerebral aqueduct. And those babies, CSF is being produced by the choroid plexus of the lateral ventricle as well as third ventricle. But CSF cannot come down and cannot drain well. So what will happen? Both lateral ventricles will expand as well as third ventricle will expand in congenital case. And because in children, in infancy, sutures are yet pliable. They are not calcified. Skull is pliable. So it's quite possible that skull also start enlarging and you have very big skull. That is a truly skull with a lot of water, right? So in these children where there is congenital blockage or stenosis of cerebral aqueduct, what really happens that both lateral ventricle as well as third ventricle, they enlarge massively, and not only they damage the central nervous system or cerebral cortex, but they also expand the whole skull. Is that right? And another point, in this case, expansion of lateral ventricle is symmetrical. Both are bilaterally enlarged. When foramen Monro was blocked, only one side was enlarged, other was not. So we say there is asymmetric enlargement when there was foramen Monro block. So in case of third case, there will be symmetrical enlargement of both lateral ventricles and as well as there will be enlargement of third ventricle. Am I clear? Right? Now there could be other causes also for the blockage at this point. One, I told you just congenital stenosis, that there was abnormal development of cerebral aqueduct, which is also called aqueduct of Sylvius. But there can be other causes also. For example, there may be tumor here. There may be cancer here or tumor here, and that tumor, when it expands, it compresses the cerebral aqueduct. This type of problem is more commonly seen in after infancy, right? So there may be tumors which block it and they produce hydrocephalus. Am I clear? Then we come ahead. You may come across patients who have tumors of the cerebellum, and cerebral tumor, of course, if let me draw it here. If there's a tumor of cerebellum and expanding like this may block the foramen magendi, or if tumor goes laterally, it may block also foramen lashka. Is it right? So if there is problem like this, right, you will have bilateral expansion of lateral ventricle, as well as there will be expansion of third ventricle, as well as there will be expansion of fourth ventricle. Is that right? Now, let's have a little test. So at fourth cause, problem may be with the magendi and lashkas, right? That somehow the drainage is impaired and CSF is unable to get out of the central nervous system into subarachnoid space, right? Now, if you find that there is only one ventricle enlarged, where is the obstruction? Monroe. If both ventricles are enlarged and third ventricle is also enlarged, both lateral as well as third, maybe cerebral aqueduct. If both ventricles are enlarged, plus third ventricle is enlarged, and plus fourth ventricle is also enlarged, where could be the obstruction? Yeah? Magendi and lashkas. Now, we have discussed the four causes. There can be fifth causes as well. You know the CSF, when it comes out from here, right, it has to travel like this. Am I right? And eventually it should go to subarachnoid space up to villi. Is that right? And through those villi, it should be drained into superior sagittal sinus. Am I clear? If someone develops very severe infection of meninges, especially tuberculous meningitis, in cases of tuberculous meningitis, if they are not treated properly, so much caseous material is made at the brain, base of the brain, that if tuberculous meningitis patients survive, healing is by fibrosis. Let me tell you, if you get injury here and you survive and there's a very big injury, there will be scar formation or not? There will be scar formation. In the same way, there will be scar formation at the base of the brain. And if there are a lot of scars formed here, if there are a lot of scars and adhesions formed here, do you think CSF can really circulate well? No. So what will happen? Hydrocephalus. Is that right? So how many points? That number one, production is more. Number two, foramen Monroe blocked by the colloid cyst. Number three, aqueduct is blocked either by the congenital defect or by the compression by tumors. Then fourth ventricle outlets are blocked, lashkas and magendi, and then blockage may be at in the subarachnoid space due to adhesion formation. Is that right? Due to multiple scarring. It is classically seen in patient with tuberculous meningitis. Am I clear? Then you may have some patient, everything is okay and CSF reaches here, problem is here. This was problem number 5 and 5, right? Adhesions. Problem number 6 may be here. Problem is with the arachnoid villi and granulations. Something is stuck there. For example, if you have subarachnoid hemorrhage and lot of RBCs go and clog this, or you had infection of the brain or meninges and lot of white blood cells and bacteria and their debris, they get stuck over the villi. All the channels within the villi are clogged or blocked. You will end up with hydrocephalus. And that will be an example of reduced drainage. That will be the example of reduced drainage. Am I clear? Rarely some babies are born with impaired function of granulations and villi, arachnoid granulations and villi. Either villi are too less or they are in normal number but they are not functioning well. So there may be congenital cause of hydrocephalus in which problem is with the drainage system, and when drainage is not okay, then again hydrocephalus will be there. right? Either it is due to congenital defect or it may be acquired later on problem, maybe due to infection or some tumor cells block, some tumor cells through the CSF float and block it, or some RBCs or WBCs or bacteria or fungal, right? All if they block these drainage system, right, hydrocephalus will be there. Am I clear? Then, you know where the superior sagittal sinus drains? Do you know or you don't know? You really know the sinuses, dural sinuses, or you don't know? Have you studied the dural sinuses? You have studied it, that's good. So let me make one diagram that how the blood from superior sagittal sinus drains. Let me make first, you have to tell me rapidly what I am drawing. This is crista gali. Of course, you have a nose there. Is that right? And you do have a mouth. Now, look. So now you understand what I'm drawing? This is the cranial cavity, anterior cranial fossa, middle cranial fossa, posterior cranial fossa, right? Later on, I will teach you dural sinuses into detail. But right now, I'll just show you how the drainage eventually, what is the drainage system for this. Here is your jugular foramen. Don't forget, this is foramen magnum. Thank you for remembering it. Now, actually, from crista gali, here is tentorium cerebelli. You know tentorium cerebelli? Right? This is tentorium cerebelli. I've purposely cut it from here and shown you jugular foramen. Now, look at it. From here, from crista gali, and what is it? Falx cerebri. You are yourself intelligent, right? This is falx cerebri. Now, what really happens? Superior sagittal sinus runs into this in its upper border. You know it? Superior sagittal sinus is running here. This sinus into which this is draining, that is actually running into this superior sagittal sinus, right? And it comes into occipital area. From here, this will go to horizontal sinus. Blood will go to horizontal right side as well as on the left side. Superior sagittal sinus. Then here is tentorium cerebelli. Is that right? Blood is running like this in superior sagittal sinus and it comes over here. From here it will move on the side as well as on other side. Is that right? In this way, blood will come into this area. From this area, there is a special good. So blood will eventually through sigmoid sinus will go to this area. Right? And here is the bulb of internal jugular vein. Am I really clear? So actually, CSF, which is absorbed in superior sagittal sinus, if you really want to know exactly how it is, so it is here. You get it? And this is the blood channel which is moving through this. Is that right? So superior sagittal sinus drains it up to where? What are these sinuses? Yes, transverse sinus into sigmoid sinus, eventually internal jugular vein. Clear? Now let me tell you the relevance with our lecture. That I was telling, problem number 6 is that drainage is impaired. There can be another problem. The drainage is perfectly okay. That in this sinus, CSF is going well, but sinus itself is thrombosed. Blood in the sinus develop a clot or thrombosis. Do you think CSF can be drained? No, so that is another cause of hydrocephalus or high CSF pressure. So it means CSF drainage can be impaired when granulations are having dysfunction, arachnoid granulation or arachnoid will have dysfunction, or drainage can be impaired in another patient where villi and granulations are perfectly okay. Problem is with the superior sagittal sinus that it has developed due to some reason thrombosis. Thrombus is formed there, blood clot is formed there. Or, in some very rare example, internal jugular vein is blocked. There are some tumors at the base of the cranial cavity which may block the internal jugular vein, right? So in those patients where internal jugular vein is blocked, all the way up CSF pressure goes up. Am I clear? If you really want to imagine well, there is a clinical test for it. I will tell you later that if patient is lying on the couch with left lateral position, you remember last time I told you how to do lumbar puncture and see the pressure. If that patient is lying there, you have done the lumbar puncture and you are seeing the CSF pressure. If you block his internal jugular vein, CSF pressure in lumbar area will show rising. Is that right?